Have you ever heard a ringing in your ears that just won't go away? You're not alone. Today, we're diving deep into the triggers of tinnitus and, most importantly, how you can prevent it. Stay tuned. Chapter 1. Understanding tinnitus. Tinnitus is a condition characterized by the perception of noise or ringing in the ears when no external sound is present. This phantom noise can vary in pitch from a low roar to a high squeal and may be heard in one or both ears. For some people, tinnitus can be a minor nuisance, while for others, it can significantly impact daily life, making it difficult to concentrate or sleep. There are two main types of tinnitus, subjective and objective. Subjective tinnitus is the most common form and is heard only by the individual. It is often caused by problems in the outer, middle, or inner ear, or by issues with the auditory nerves or the part of your brain that interprets nerve signals as sound. Objective tinnitus, on the other hand, is rare and can be heard by a doctor during an examination. It is usually caused by a blood vessel problem, a middle ear bone condition, or muscle contractions. Understanding these basics is crucial because it helps us recognize the potential underlying causes and the wide variety of experiences people have with tinnitus. Knowing the type of tinnitus you have can guide you toward the most effective treatments and coping strategies. In the upcoming chapters, we will delve deeper into the primary triggers of tinnitus and provide practical tips to prevent and manage this condition. Chapter 2. Noise exposure. One of the primary triggers of tinnitus is exposure to loud noise. This can happen in a variety of settings, such as attending a rock concert, working in a noisy environment like a construction site, or even listening to music at high volumes through headphones. Prolonged exposure to loud sounds can damage the hair cells in the cochlea of the inner ear, leading to permanent hearing loss and the onset of tinnitus. Noise-induced tinnitus often manifests as a persistent ringing, buzzing, or hissing sound. Many people experience temporary tinnitus after a loud event, which usually subsides after a few hours. However, repeated exposure can lead to chronic tinnitus, which can be much harder to manage and more disruptive to daily life. To prevent noise-induced tinnitus, it's essential to take proactive measures. First, use ear protection, such as earplugs or noise-canceling earmuffs, when you know you'll be in a loud environment. This is particularly important for musicians, construction workers, and anyone else regularly exposed to high noise levels. Second, be mindful of your listening habits. When using headphones, follow the 60-60 rule. Listen at no more than 60% of maximum volume for no more than 60 minutes at a time. This simple guideline can significantly reduce the risk of damaging your hearing. Lastly, consider investing in noise-canceling headphones, which can help you enjoy music or podcasts at lower volumes by blocking out background noise. Protecting your hearing from loud sounds is one of the most effective ways to prevent tinnitus and preserve your overall ear health. In the next chapter, we will explore how ear infections and blockages can contribute to tinnitus and what steps you can take to prevent and treat these issues. Chapter 3. Ear infections and blockages. Ear infections and blockages are another common trigger for tinnitus. When the ear canal or middle ear becomes inflamed or blocked, it can disrupt the normal functioning of the auditory system, leading to tinnitus. Ear infections, especially in the middle ear, can cause fluid buildup and pressure changes, which can result in a temporary or sometimes persistent ringing or buzzing sound. Earwax blockages are a frequent culprit. While earwax is essential for protecting and lubricating the ear canal, too much of it can build up and become impacted. This blockage can prevent sound waves from reaching the eardrum, causing a muffled hearing and potentially triggering tinnitus. To prevent tinnitus caused by ear infections and blockages, it's important to maintain good ear hygiene and seek medical attention when needed. Here are a few practical tips. 1. Avoid using cotton swabs. While it might be tempting to use cotton swabs to clean your ears, they can actually push earwax further into the ear canal, causing blockages. Instead, use ear drops or an ear irrigation kit to safely remove excess earwax. 2. Treat ear infections promptly. If you experience symptoms of an ear infection, such as ear pain, fluid drainage, or hearing loss, see a healthcare provider promptly. Early treatment with antibiotics or other medications can help prevent complications, including tinnitus. 3. Regular checkups. Regular visits to an ear, nose, and throat (ENT) specialist can help identify and address any ear issues before they lead to tinnitus. An ENT can safely remove earwax and provide treatment for infections or other conditions affecting your ears. By taking these preventative measures, you can significantly reduce the risk of tinnitus caused by ear infections and blockages. In our next chapter, we'll delve into how certain medications can lead to tinnitus and what you can do to mitigate these side effects. Chapter 4. Medication side effects. Certain medications are known to have tinnitus as a potential side effect. These drugs, known as ototoxic medications, can cause damage to the inner ear, leading to hearing loss and tinnitus. While not everyone will experience these side effects, it's crucial to be aware of the risks, especially if you are taking these medications long-term or in high doses. Common ototoxic medications include antibiotics. Some antibiotics, particularly aminoglycosides like gentamicin, can be ototoxic. Nonsteroidal anti-inflammatory drugs, NSAIDs, drugs such as aspirin and ibuprofen, especially when taken in large doses, can cause tinnitus. Diuretics. Medications like furosemide, used to treat high blood pressure and heart failure, can sometimes lead to tinnitus. Chemotherapy agents. Certain drugs used in cancer treatment, like cisplatin, are known to have ototoxic effects. To prevent tinnitus caused by medication side effects, consider the following tips. 1. Consult your doctor. Always discuss the potential side effects of any new medication with your healthcare provider. If you are concerned about tinnitus, ask if there are alternative medications with a lower risk of ototoxicity. 2. Follow dosage instructions. Taking medications exactly as prescribed can help minimize the risk of side effects. Avoid self-medicating or adjusting your dosage without consulting your doctor. 3. Monitor your hearing. If you start experiencing ringing in your ears or any other hearing issues after beginning a new medication, report these symptoms to your doctor immediately. Early intervention can help prevent further damage. 4. Regular hearing checkups. If you are on long-term medication that is known to be ototoxic, regular hearing tests can help detect any changes early on. This allows for timely adjustments to your treatment plan to protect your hearing. By being proactive and informed about the medications you take, you can significantly reduce the risk of tinnitus. In our next chapter, we will explore the connection between hearing loss and tinnitus, and how addressing hearing loss can help manage tinnitus symptoms. Chapter 5. Hearing loss. Hearing loss is closely linked with tinnitus. In fact, many people with hearing loss also experience tinnitus. When the brain receives less auditory input due to hearing loss, it sometimes creates phantom sounds to compensate for the lack of external stimuli, leading to the perception of ringing or buzzing in the ears. Hearing loss can result from various factors, including aging, exposure to loud noises, genetic predispositions, and certain medical conditions. Presbycusis, or age-related hearing loss, is particularly common and often accompanied by tinnitus. Addressing hearing loss can significantly reduce the severity of tinnitus symptoms. Here are a few strategies. 1. Regular hearing tests. Schedule regular hearing evaluations, especially if you are over 50 or frequently exposed to loud noises. Early detection of hearing loss allows for timely interventions that can prevent or reduce tinnitus. 2. Use of hearing aids. For those with hearing loss, hearing aids can be highly effective. These devices amplify external sounds, reducing the brain's need to generate phantom noises. Many modern hearing aids also have built-in tinnitus masking features that help distract from the ringing or buzzing sounds. 3. Protect your hearing. Prevent further hearing loss by protecting your ears from loud noises. Use earplugs or noise-canceling headphones in noisy environments and keep the volume at a safe level when using headphones or earbuds. 4. Healthy lifestyle choices. Maintain a healthy lifestyle to support overall ear health. This includes managing chronic conditions like diabetes and high blood pressure, avoiding smoking, and eating a balanced diet rich in vitamins and minerals that support hearing health. By taking proactive steps to manage hearing loss, you can alleviate tinnitus symptoms and improve your overall quality of life. In our next chapter, we will discuss how head and neck injuries can trigger tinnitus and what measures can be taken to prevent such injuries. Chapter 6. Head and neck injuries. Head and neck injuries are significant triggers for tinnitus. Trauma to these areas can affect the auditory system, leading to the onset or worsening of tinnitus symptoms. The delicate structures of the ear, as well as the nerves that process sound, can be damaged by impacts, causing persistent ringing or buzzing sounds. Common causes of head and neck injuries include car accidents, sports injuries, falls, and even certain medical procedures. The damage can range from mild concussions to more severe injuries like skull fractures or whiplash, each potentially affecting the inner ear and the auditory pathways. Preventing head and neck injuries is crucial for reducing the risk of tinnitus. Here are some practical tips. 1. Use proper safety gear. Whether you are playing sports, riding a bike, or working in a hazardous environment, always use appropriate safety gear. Helmets, neck braces, and other protective equipment can significantly reduce the risk of injury. 2. Practice safe driving. Always wear your seatbelt, follow traffic rules, and avoid distractions while driving. In case of an accident, proper use of safety features in your vehicle can minimize the impact on your head and neck. 3. Maintain a safe environment. At home or work, ensure that your surroundings are free from hazards that could cause falls or other injuries. Use non-slip mats, secure loose rugs, and keep walkways clear of obstacles. 4. Engage in strengthening exercises. Regularly perform exercises that strengthen the neck and upper body. Stronger muscles can provide better support and protection against injuries. 5. Seek immediate medical attention. If you experience any head or neck injury, seek medical help promptly. Early treatment can prevent complications, including the development or worsening of tinnitus. By taking these preventive measures, you can protect yourself from head and neck injuries and reduce the risk of tinnitus. In our next chapter, we will explore how stress and anxiety can exacerbate tinnitus and share effective strategies for managing these mental health challenges. Chapter 7. Stress and anxiety. Stress and anxiety are not only common triggers for tinnitus, but can also exacerbate existing symptoms, creating a vicious cycle. When you're stressed or anxious, your body goes into a state of heightened alertness, which can intensify the perception of tinnitus. This heightened state can make the ringing or buzzing in your ears seem louder and more intrusive. Understanding the link between stress, anxiety, and tinnitus is crucial for managing the condition effectively. When the brain is overloaded with stress signals, it can amplify the auditory signals that are perceived as tinnitus. Additionally, the emotional distress caused by tinnitus can further increase stress and anxiety levels, making the symptoms more severe. Here are some strategies to manage stress and anxiety to help alleviate tinnitus symptoms. 1. Mindfulness and meditation. Practicing mindfulness and meditation can help calm your mind and reduce the impact of stress on your body. These techniques teach you to focus on the present moment and can decrease the perception of tinnitus over time. 2. Regular exercise. Physical activity is a powerful stress reliever. Regular exercise helps release endorphins, which are natural mood elevators, and can help reduce the severity of tinnitus symptoms. 3. Cognitive behavioral therapy, CBT. CBT is a type of therapy that helps you change negative thought patterns and behaviors. It can be particularly effective for managing the emotional response to tinnitus and reducing the distress it causes. 4. Relaxation techniques. Techniques such as deep breathing exercises, progressive muscle relaxation, and yoga can help lower stress levels and mitigate the impact of tinnitus. 5. Healthy sleep habits. Stress and anxiety can disrupt sleep, which can further worsen tinnitus symptoms. Establishing a regular sleep routine and creating a restful sleeping environment can improve sleep quality and reduce tinnitus-related distress. By integrating these stress management techniques into your daily routine, you can create a more relaxed and balanced state of mind, which can significantly reduce the perception of tinnitus. In our next chapter, we will discuss how dietary and lifestyle factors can influence tinnitus and provide practical tips for making positive changes. Chapter 8. Dietary and lifestyle factors. Dietary and lifestyle factors play a significant role in the management and prevention of tinnitus. What you eat and how you live can influence the severity and frequency of tinnitus symptoms. By making mindful choices, you can reduce the impact of tinnitus on your daily life. Certain foods and beverages can trigger or worsen tinnitus. For instance, high sodium intake can increase blood pressure and, in turn, exacerbate tinnitus symptoms. Similarly, caffeine and alcohol can affect the inner ear and increase the perception of ringing or buzzing sounds. To manage tinnitus effectively, consider these dietary adjustments. 1. Reduce sodium intake. Lowering your salt consumption can help manage blood pressure and reduce fluid retention, which can alleviate tinnitus symptoms. Opt for fresh, whole foods over processed and canned items, which often contain high levels of sodium. 2. Limit caffeine and alcohol. Caffeine and alcohol can stimulate your nervous system and worsen tinnitus. Try to reduce your intake of coffee, tea, energy drinks, and alcoholic beverages to see if your symptoms improve. 3. Stay hydrated. Dehydration can affect your ear health. Ensure you drink plenty of water throughout the day to maintain proper hydration levels. 4. Healthy diet. Incorporate a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Nutrients such as magnesium, zinc, and vitamins A, C, and E are beneficial for ear health. Lifestyle habits also play a crucial role in managing tinnitus. 1. Regular exercise. Physical activity improves blood circulation, which can positively affect ear health. Aim for at least 30 minutes of moderate exercise most days of the week. 2. Avoid smoking. Smoking can reduce blood flow to the sensitive structures of the ear, worsening tinnitus. Quitting smoking can have numerous health benefits, including improving your ear health. 3. Stress management. As discussed in the previous chapter, managing stress through relaxation techniques, meditation, and proper sleep hygiene can significantly reduce tinnitus symptoms. By making these dietary and lifestyle changes, you can create a healthier environment for your ears and reduce the severity of tinnitus. In our next chapter, we will explore how certain medical conditions can contribute to tinnitus and what you can do to manage these conditions effectively. Chapter 9. Medical conditions. Several underlying medical conditions can contribute to the development or worsening of tinnitus. Understanding these conditions and managing them effectively is key to alleviating tinnitus symptoms. Here are some common medical conditions associated with tinnitus. 1. Hypertension, high blood pressure. High blood pressure can damage blood vessels throughout the body, including those in the ears. This can lead to tinnitus or exacerbate existing symptoms. Managing hypertension through lifestyle changes and medication can help reduce the risk of tinnitus. 2. Diabetes. Diabetes can affect blood circulation, including in the ears. Poor circulation can damage the hair cells in the inner ear, leading to tinnitus. Managing blood sugar levels through diet, exercise, and medication can help prevent tinnitus associated with diabetes. 3. Meniere's disease. This inner ear disorder is characterized by episodes of vertigo, hearing loss, and tinnitus. Managing Meniere's disease typically involves a combination of lifestyle changes, medication, and in some cases, surgery. 4. Thyroid disorders. Conditions like hyperthyroidism and hypothyroidism can affect hormone levels in the body, which can in turn impact tinnitus. Managing thyroid disorders with medication and lifestyle changes can help reduce tinnitus symptoms. 5. Cardiovascular disease. Diseases that affect the heart and blood vessels can also affect blood flow to the ears, leading to tinnitus. Managing cardiovascular health through diet, exercise, and medication can help prevent tinnitus associated with these conditions. It's essential to work closely with your healthcare provider to manage these conditions effectively. By addressing the underlying medical issues, you can reduce the severity of tinnitus and improve your overall quality of life. In our final chapter, we will discuss the importance of seeking professional help for tinnitus and explore the available treatment options and support resources. Chapter 10. Seeking professional help. Seeking professional help is essential for effectively managing tinnitus. A healthcare provider, such as an audiologist or an ear, nose, and throat (ENT) specialist, can provide a thorough evaluation and recommend appropriate treatment options. Here are some key steps to take when seeking professional help for tinnitus. 1. Diagnostic evaluation. Your healthcare provider will conduct a comprehensive evaluation to determine the underlying cause of your tinnitus. This may include a physical examination, hearing tests, and imaging studies. 2. Treatment options. Depending on the cause and severity of your tinnitus, your healthcare provider may recommend various treatment options. These may include sound therapy, using external noise to mask the perception of tinnitus. Counseling, cognitive behavioral therapy, CBT, or other forms of counseling to help you cope with tinnitus-related distress. Medication. In some cases, medication may be prescribed to alleviate symptoms or treat underlying medical conditions contributing to tinnitus. Medical procedures. For certain cases of tinnitus, medical procedures or surgery may be necessary. 3. Lifestyle changes. Your healthcare provider may recommend lifestyle changes, such as dietary adjustments, stress management techniques, and hearing protection, to help reduce the severity of your tinnitus. 4. Follow-up care. Regular follow-up appointments with your healthcare provider are essential to monitor your tinnitus and adjust your treatment plan as needed. 5. Support groups. Joining a support group for individuals with tinnitus can provide valuable emotional support and coping strategies. It's important to remember that tinnitus is a complex condition with no one-size-fits-all solution. Working closely with your healthcare provider and following their recommendations can help you manage your tinnitus effectively and improve your quality of life. As we conclude our exploration into tinnitus relief, we hope you found valuable insights and tips to help manage this condition. Remember, you're not alone in this journey. Stay tuned for more expert advice and inspiring stories. Don't forget to like, share, and subscribe for future updates. Thank you for watching, and may you find peace and relief on your tinnitus journey. Have a wonderful day.